We understand there are so many contributing factors to COVID-19 vaccine hesitancy, but somehow fear of needles or injections is said to be more widespread. To share some light on this, Nurse Loraine Lombard joining us now on the Midday View. Good afternoon, ma'am. Thank you very much for your time. I was listening to a government official the other day who says they've realized that many people are scared of injections, of needles. What's been the experience for you as a nurse? Are we scared of injections, and that's why we don't want to come forward and get the jab?
Yes. I think this phenomenon is very prevalent, and it's at a very appropriate time that we're dealing with the subject of trypanophobia, which is this intense fear of needles.
Now, can you tell us, how widespread is it from what you are hearing in the health care fraternity? Are you seeing more people saying, I don't mind being vaccinated, but I'm scared of the needle?
Yes. Well, in fact, in the UK, research has shown at Cambridge University that 1 in 10 people have this intense fear of needles. And the USA research has shown that up to 25% of people are intensely worried about having the vaccine due to their fear of needles.
I wonder what the numbers look like in South Africa. I saw reports last week, even hearing government officials saying there's more men, for example, in Gauteng, who don't want to get the jab. And many men are said to be scaredy cats. They don't want the jab because of the fear of the needle. But it's a serious issue. What are you finding out in South Africa?
Yes, it is a serious issue. We found in South Africa that it's mainly women who are fearful. It's people who have a history of multiple medical interventions or procedures which have been painful. So pain is a big issue here. And we found that people have not been educated enough regarding the vaccine. They don't know what's been put into it. They don't know the side effects. And this has caused a lot of fear. They do believe that there's also a genetic component, but largely the cause is unknown.
Yes, and as we conclude, Nurse Loraine, what do you tell somebody sitting in front of you and you're about to give them a jab and you notice that they are really not looking forward to the pain of that needle as it gets into the flesh? What do you tell them to calm them down? Very quickly.
Yes, well, they can be very anxious. They can have panic attacks, nausea, and vomiting in front of us. They can almost faint. So we tell them we tell people to bring a friend. We use distraction is important. They could have music on or a video. They could be lying down if possible, if they tend to faint at the sight of needles. And also a numbing agent may help on the arm. It will be less painful. Then there's breathing and relaxation techniques that are important. And even the use of an anti-anxiety tablet may be necessary, or therapy if it's a long-term, if the person is needing more than one injection or vaccine.
It's indeed a serious issue. Thank you very much, Nurse Loraine Lombard. You talked about therapy there. In fact, my next guest is a psychologist. That's Dr. Colinda Linde, who is joining us now to continue talking about the serious issue of the fear of needles, the phobia of injections. Dr. Linde, good afternoon. Well, I've just confirmed with Nurse Loraine Lombard that it is true that in South Africa currently one of the many factors that are contributing to COVID-19 vaccine hesitancy is a fear of injections, and she does say it's a serious issue globally as well. And in some cases, the nurses advise people to go for therapy. So what is a phobia? What is a fear of needles or injections? What is it?
Well, any phobia is very specific. So it could be maybe you're not scared of spiders or dogs, but when there's a needle, then absolutely that's something you don't want to be near. So everything that your previous guest said, absolutely spot on. In the psychology research, it's exactly the same. So basically, the needle phobia could be some people don't like being injected with something going in. Some people don't like something going out, as in getting blood. So it's a family of symptoms, but you also need to look very specifically. And in fact, as Nurse Loraine said, if somebody's had a lot of medical procedures, there's a conditioned response, there's fear. But sometimes it could just be that somebody close to you has had a lot of medical procedures and you associate that fear with you saw them getting injected a lot. Or perhaps you've heard a terrible story. So as she said, you know, there isn't one cause. It can be multiple causes. But certainly you can imagine in terms of vaccines, it's having quite an impact.
Yeah, and treatment, I mean, the nurse was talking about sometimes people, it is so severe that they might need therapy. From a psychological perspective, I mean, what form would such therapy take, for example?
Well, you know, there's normal needle phobia and then there's the fear of vaccines. So I'm actually going to answer that in two parts. So I think what's happening at the moment in the press and around the world is that there's this huge debate, should you, shouldn't you, you know, around getting the vaccine. So there's a mistrust before and during and even after. So let me address that first and then I'll talk about the therapy. So step one is, where is your mistrust? Are you actually scared of the needle? Or is it that you mistrust what's in the vaccine? Is it that you don't normally like vaccines? Is it that you don't trust the government? You know, who don't you trust? And that's the first thing to do. And especially if it's based on, well, I heard a story that somebody was perfect and then they got the vaccine and then they died. So first of all, isolate where is your specific mistrust. Is it in fact about needles or is it something with that? And you're saying it's needles, but it's actually something else. And then go on a fact-finding mission. I've done it, and I suggested to everybody else that you go on a fact-finding mission. And, you know, you can find information. Dr. Google, we always look. But find a human, you know, speak to a nurse, speak to more than one doctor. That's the first part. Then the second part is, if you really have a fear of needles, it could be just that normal, you know, just like some people are scared of spiders, most of us don't like them, but for some people it's a phobia where you have an extreme panic reaction. So if that's you with needles, then there's definitely a protocol to follow.
Okay.
So you would do cognitive behavior therapy, which is basically a desensitizing. So you would maybe start with, you know, having a syringe lying there and then building up to watching videos of people getting the vaccine and so on until you could actually touch yourself with a pin and so on.
Okay, Doctor. No, thank you very much for sharing a little bit some insights there. Dr. Colinda Linde, psychologist there. It is a serious issue, this fear or phobia